And welcome to Monday Night Meetup. I am your host, Commonwealth Victim Advocate, Suzanne Estrella. You have entered a safe space for thoughtful conversation and honest reflection. I do need to let you know that there's no expectation of privacy. We're streaming live through Facebook, and we are going to upload this conversation to our YouTube channel at a later date so that folks can listen at their convenience. So welcome to everyone. Tonight we have a really great panel. We're talking about Mental Health Awareness Month. Now, the framework for this conversation tonight, we're going to be looking about how mental health impacts the work we do as advocates of the Office of Victim Advocates and other victim service providers, as well as how we see mental health impacting our desire to create safer communities and what that looks like maybe in some spaces that you might not imagine we have so many mental health services. So I'm going to give each of our panelists an opportunity to introduce themselves and tell us a little bit about how this whole mental health conversation impacts them and the work that we do. And then after that, we'll hit on some questions. So I'm just going to start as the way you all appear on my screen. So I'm going to start with you, Lucas. Tell us about who you are and the work that you do and where you do that work.
Good evening, everybody. Suzanne, thank you for the wonderful introduction. My name is Dr. Lucas Milischak. I am the director of the psychology office for the Pennsylvania Department of Corrections. I've been in that role for about 5 years, and in that role, I'm responsible for leading, I think, one of the best teams in the Commonwealth, a team of psychologists who are responsible for the quality assurance and quality improvement and general clinical and administrative oversight of mental health services that are delivered within our 24 state correctional institutions. Wonderful to be here this evening. Thank you.
Thank you so much. We look forward to hearing more about that. Jen?
Good evening, everyone. My name is Jen Digby. I am also with the Pennsylvania Department of Corrections. I am a corrections treatment program administrator, and one of the main jobs that I am tasked with is the Trauma-Informed Care Initiative. Pennsylvania is working towards becoming a trauma-informed state. So I am the one that oversees what that initiative is going to look like for the Department of Corrections.
Awesome. Look forward to hearing so much more about that. I was so excited when I got that email last week detailing how you all had that set in policy. So I'm really excited and looking forward to hearing more about that initiative. Lisa.
Hi, my name is Lisa Ryan. I am the licensed clinical social worker for the Office of the Victim Advocate. I've been in this role for about 2 years now since we've had one on staff and have been developing the position. We obviously have a lot of resources to provide to crime survivors through our office, and we have created a new support group for crime survivors that I'll be discussing tonight. I also provide trauma training throughout the state to help others understand just what trauma is, trauma responses, and assist with mindfulness and grounding skills to help calm the nervous system. So that's a big part of my role. Thanks for having me.
Sure, thank you. Marianne?
Hi, everybody. My name is Marianne McAvoy. I'm the Executive Director and Child Advocate for our Governor's Office of Advocacy and Reform. Our office was developed and tasked with creating a plan for Pennsylvania to become a trauma-informed state. So we convened a think tank of professionals from all over Pennsylvania, and we published the Trauma-Informed Pennsylvania Plan in July of 2020. Which is the document that all of our amazing agencies are using as they work to become trauma-informed. And since publishing that plan, we also created HEAL PA, which is the statewide coalition that is working to implement that plan. So we have members from the various agencies sitting on multidisciplinary action teams to really make those plan recommendations a reality. And I'm very excited to be here on behalf of our team. and to talk about mental health. You know, I play two roles. I work as executive director and child advocate, and in that child advocate role, I always stress how important trauma prevention and intervention are to the well-being of our children in Pennsylvania. So I'm really looking forward to a robust conversation with all of you tonight. Thanks for having me.
Thank you so much. Certainly. And now Tara is just here as our tech person. If you have comments or questions, please drop those in the chat, and then Tara will make sure that we get to your questions and get you some answers. And if we can't do that in tonight's program, you can put your email or anything, and we'll make sure that we get you some answers. Also, Tara's going to be listing lots of resources that you may want to avail yourself to in the chat. So check out all those resources, some events that are happening around Mental Health Awareness Month here in Harrisburg and throughout the state. So make sure you check out those resources. So I think it might be a good idea if we kind of start with some definitions, because we're kind of throwing out a lot of terms that as service providers, we're probably familiar with and comfortable with, but it's possible that some victims who are listening might not understand the terms in the way that we see them. For instance, when you talk about mental health, often for like what I'll call the average Joe, their perception is going to be like, well, I'm not crazy, so I don't need to hear about that. When you talk about trauma, sometimes people think, well, that's what happens to the other person, or when they can't cope, but that's not me. So how about if, and this could be anyone who feels like they would like to give us, or even if everyone wants to say a little bit of piece about what you think would be important to kind of address that. What do you mean, or what do we mean when we say mental health? And then what does it mean to be trauma informed? Anyone who would like to go?
Suzanne, I can start off. One thing that I would definitely start out by saying is that trauma is very individual and unique. And that is, it makes our job, as service providers, to really get to know the individual and what experience that they had from the trauma, from what took place. It's not necessarily what happened or the event or incident that happened to them, but more their response to it. So I think that's also often a misconception on, what trauma is and how it impacts someone.
Great, thank you for that. Anybody else have anything they want to add?
I would add two things. So when you had also asked what it would take to become trauma informed, I think it's important to make sure that we emphasize that you can take a training, a trauma 101 training, that's not going to lead to being trauma informed, right? So if you look at the trauma informed PA plan, we actually have a continuum. And the first step is just becoming trauma aware and really starting to understand what trauma is, what it looks like, not just knowing what it looks like in our communities, but what it looks like within ourselves. Because I know we'll talk on this a little bit later, but we all need to be actively healing from our own trauma and our own experiences and taking care of our own mental health. And we have to, if we're asking people to be vulnerable and come to the table and learn about these things, we cannot be scared, as even if we're in senior level government positions, to say, hey, I struggle with my own mental health sometimes. I've experienced my own trauma, and it may look different than yours, but it was very real for me, and it impacts the way I interact with my communities and my colleagues and my family. And that's why this is important.
Right, great. I agree with that. I think it's so important that we recognize that these are issues that we face as people, not because something happened to you, or because you're in a certain economic class or racial class or anything like that. These are just, they're people issues. So all of us people have to learn how to deal with this and grow and build the proper skills for dealing with it in healthy ways. Anyone have anything else they want to add to that? Like, I don't know, is there like a nutshell definition that you could provide for mental health?
If I would say mental health, I would say it's your well-being, good or bad, and where you are at the present moment. when you in life, regardless of your surroundings or what's around. I think especially I came into the correctional setting 22 years ago total, and we didn't speak about trauma. We didn't speak about how it affected us, how it affected our jobs, how it affected the clientele that we worked with. And I believe we've done a complete 180 just probably in the last 5 years as far as being able to come forward and express and openly express and not be judged based off of the experiences that you've had that brought you to that point in life.
Awesome. That's a good point. Okay, Marianne, I think I'm gonna start some questions with you. Tell us about hashtag We Heal Us and what's the Commonwealth plan and things like that.
Yeah, so about 2 years ago, we met colleagues in Illinois who were doing very similar work around trauma at a state level. And they came to us and they said, we want to come together and we want to celebrate May as Mental Health Awareness Month, but also as Trauma Awareness Month, because we want our citizens to understand that trauma and mental health truly go hand in hand. So we've been working with them for a number of years. And last year they started the We Heal Us campaign, which includes every state in the US. So we were very excited to join on that campaign. I'm excited to say that, I mean, maybe I'm a little biased here, but I think Pennsylvania has the most, this is the second year, and this is the second year where I've said we have so many more events than I ever anticipated people coming forward and wanting to host. And that's so exciting to me, because how often do people talk about mental health and say, well, the hardest thing is getting access to therapists and counselors, and we can learn and we can do some of this healing work together as well as a community. So all of these organizations that step forward and say they want to host events, these are very healing centered events, and being part of them, you're going to learn something about people that you interact with every day. But again, like I said, you're going to learn about yourself and about things you experienced and how that's showing up for you that you may not have realized. And they're all free. All these organizations, all these agencies are saying, we want to provide this. It's no charge. Here's the link. Get this out to everyone in Pennsylvania. We want to make sure that we're lifting up and centering healing all over the Commonwealth. So it's very powerful. It's an exciting month for our office. We always love it.
Yeah, that's awesome. So now I want to point out, because some people might be thinking like, well, what does the Department of Corrections have to do with this? And I think often people don't realize how both the Department of Corrections and the Pennsylvania Parole Board are really strong collaborative partners with the Office of Victim Advocate, and so connected to the work that we do in working to create safer, caring communities where justice thrives. And I was really surprised to hear, and I've heard it like several times in more than one space, that the Department of Corrections is the largest mental health service provider in the state of Pennsylvania. So if Jen and Lucas, if you could kind of break that down for us as to what does that actually mean, and why do you think that is the case?
Jen, do you want me to take a crack at that one?
Sure, go ahead.
Okay. Suzanne, I think it's a great question. I'm not sure that there's any objective facts behind the fact that we are I will say, I think it's accurate to say we're one of the larger mental health providers. And I think, you hear those statements, and from that, I think you feel a sense of pride in, that's what's attempting to be conveyed, is that I think our organization is proud of the work that we do in delivering mental health care services to some of the most vulnerable Pennsylvanians that are out there. And so this is typically a population of people, those people who are incarcerated in our state prisons, who are traditionally thought of as being marginalized, but it is very much a part of the fabric of our organization. And every one of our 15 or 16,000 employees, it's a part of our mission to ensure that we ensure access to mental health care throughout a person's incarceration, and that we deliver the best mental health care that we possibly can. And so I think that's where those comments come from, not necessarily that bigger is better, but that this is a part of our history and that we're really proud of the work that we do, and we take this very seriously, despite the fact that this is, again, traditionally thought of as a marginalized population. They're certainly one of the most vulnerable populations out there.
Mhm. Can you tell us a little bit about what those services look like, and then how you feel that promotes crime prevention or recidivism and things of that nature?
Sure. I mean, I think, I was thinking about the first question that you opened this discussion up with, and I wanted to share that, a mentor of mine shared with me once that there is no health without mental health, right? And so people traditionally think of these two constructs as being distinct and separate, and we like to think of them as being together, similar to what Jen said, that it's a focus on a person's overall well-being, and really you can't have one without the other. And so service delivery within the Department of Corrections, mental health care it starts on day one. So, and really it starts before day one at where Jen Digby, where she started her career at Camp Hill and spent so many good years. Like, that is the main reception area for 95% of our population. So all males are coming in through Camp Hill and or Smithfield. And before people are even showing up in our system, there are processes in place to ensure that records are being shared from county jails. So that's typically where most of our patient population is coming from, are the county jails in Pennsylvania. And so before those patients even come into our jurisdiction and into our system, there is a process for records to be shared so that we are familiar with the people that we are receiving, and so that we're aware of the risks, both health and criminogenic, that exist for these people, and the healthcare and mental health care risks that these individuals are presenting with, and the needs that these people have. And so it really begins before day one. Very briefly, when they show up within our system, they are immediately seen by qualified mental health professionals and healthcare professionals on day one. We are completing thorough suicide risk assessments of every single person that comes into our system on day one. So it's a thorough and deliberate mental status exam where we are digging into what the person is dealing with at that point in time. We are reviewing chronic and acute risk factors of suicide, and we are weighing them against the protective factors of suicide. So those things that are known to increase the risk of suicide or decrease the risk of suicide. And then we're taking this all together and generating a plan, a safety plan of wellness for this person. It's a blueprint of how we're going to keep this person safe moving into the future and throughout the duration of their incarceration as they head and prepared for reentry. Every single person that comes into our system, all males and females, they receive an objective measure of their personality as well. And so we typically are administering the personality assessment inventory to every single person. That measure gets interpreted and it gets uploaded into our electronic health record. And it really serves as a foundation of how this person sees the world. And it helps us, again, identify more needs associated with this person. We are also administering intelligence screening tools on day one to these folks who are coming into our system. And it's helping us identify other neurodevelopmental disorders that may exist, issues like intellectual disabilities. Additionally, every single person that comes into our system is screened for autism spectrum disorder, which is a fairly new space for us to begin exploring within our population. Within the last 2 to 3 years, we've also kind of expanded our reach and our screening of trauma that is experienced by our population. So every single person that comes into our system is also screened with the PCL5, as we know that our population are they are far more likely to experience trauma than compared to community samples. So at every single one of our institutions, we have multidisciplinary psychiatric review teams. So this is a holistic team of treatment professionals, healthcare and mental health care professionals, including social workers, nurses, psychologists, psychiatrists, unit managers, counselors, and even corrections officers. We include these corrections professionals into these multidisciplinary teams. And believe it or not, we also include the patient into this team, right? That is the most important person in this team is that patient. And it is services are wrapped around these people from day one until they go home.
So if I could jump in, Dr. I don't know how to say your last name, and I don't want to mess it up, so I'm going to call you Lucas, if that's okay.
Lucas is great. That's
I really appreciate in the very beginning when you started to answer this question, you said, yes, we may be the biggest, we may be called the biggest, but that doesn't mean the best, right? A lot of times when we bring that statistic out as trauma experts, it's to shed light on the fact that we are utilizing incarceration for our most vulnerable people, that there is not one person in our prisons that has not experienced trauma. So all the screenings in the world are fantastic, but they're telling us what we know. We know that 50% of our incarcerated population are victims of child sexual abuse. We know that mental health is needs to be an enormous priority for every single person who is incarcerated, whether it's in an adult facility or it's a juvenile detention facility. So I applaud all of the amazing work that you're all doing, but I see that the movement when we talk about that statistic, the movement that needs to happen is building up our communities to prevent trauma and increase healing practices before we have people entering our prisons. And one of my, I'm going to call her my good friend at this point because we've been doing so much work together and she's just phenomenal. Fritzi Horstman, she is the CEO of Compassion Prison Project. And I was very excited to get her connected with our Department of Corrections last year. And I'm hopeful, and I'd love to hear from all of you, have you started to work closely with her? Because the work that she has been doing in multiple countries is so transformative, and it is led by the people who are living in these facilities themselves. So I'd love to just hear a little bit about your background with their work and what steps you all have been taking to facilitate some of those healing activities within the prisons themselves.
I think
I'm not supposed to ask questions. I'm sorry, Suzanne, but I'm just so curious.
I do want to point out too that I think what Lucas and Jen have shared already kind of points to how, I mean, I agree with what you're saying, Marianne, that we're kind of behind. Like there's too many people going into the system, and yeah, that's like a whole nother thing of what we can do about that. But I do feel like that this approach, especially your willingness to take this trauma-informed initiative and this trauma-informed approach at the Department of Corrections is such a big piece in crime prevention for many offenders. I think that whole kind of like analysis and someone gave me this test and went through these things and pointed out this, that, the other, and told me this about trauma is like the first time, unfortunately, the first time that many offenders are actually getting that type of medical care or analysis. Like the first time that they're hearing that, oh, that was traumatic. Oh, that shouldn't have happened. Oh, this is causing me to think this way that maybe is not healthy. So yeah, I get it's so hard to balance because yes, ideally what we want is for people to never enter the system. But I think it's important that we do kind of uplift what's happening for those who are already there. So just want to put that out there. Jen, did you want to add something?
Yes, I'd say as far as I think one of the driving factors with the belief that this is the largest mental health provider is because many times nobody has addressed any of those issues prior to their point of incarceration. So then they're coming to us, and many times it's the first time somebody has actually approached that topic with them and asked these questions. Because out in the community, many people, it's taboo. And so, and it's a sign of weakness in people's eyes, you know, so many times they haven't had that ability to have that one-on-one with a professional or somebody that is trained in these type of responses in order to obtain that information from them. They haven't had somebody reach out to actually care and say, you know, have you been victimized? What have you experienced? What have you been through that brought you to this point? So I think that's one of the driving forces for that belief is because many people have not addressed what they have been through until they get to the point of incarceration.
Yeah. Now, Lisa, I know that you've done support groups both for victims and survivors, as well as for victims and survivors who you have met inside of institutions who are serving time for other crimes, but then had previous victimization. Can you tell us a little bit about the support groups that you provide and how you see that play out?
Sure. Our office at the Office of Victim Advocate is currently running a support group called Creating Resiliency, Understanding Trauma for Crime Survivors. And this is a structured group, but it's really geared toward the participants of the group, and we try to keep them small so that there is that ability to connect with one another. We offered this to anyone who is a trauma survivor or has experienced trauma because we talk about how trauma can impact us and our responses to trauma, are how common certain things are. So sometimes just talking that out and helps you connect maybe why your heart is racing or why you're feeling very fatigued. And so we talk about that in group, and then we also incorporate some grounding and mindfulness techniques, some deep breathing exercises, some meditation, also some forms of physical and mental grounding to help the survivors in those times where you do feel overwhelmed with emotion. And then we also focus on resiliency and what that looks like and what tools they can use to help them create resiliency and build resiliency moving forward. And often, they leave with, the support of one another in knowing that, forming a sense of hope as they move forward. So that is an 8-week group, and we are starting 2 more here in June. So you can contact our office. I will say I want to thank Jen and her teams for their support in connecting with SCI Muncie for our recent collaboration where I am co-facilitating a group called Beyond Trauma, and that is a support group at our women's institution Muncie, where we're having a group of short sentence parole inmates, or if they are referred to us, have the ability to be a part of this group. We use the workbook by Stephanie Covington called Beyond Trauma. Change it up a little bit, but it is for women who have experienced trauma in their lives and used addictions as forms of coping. And we do a lot of inner child work and work through a lot of, some of the things that maybe, like were said earlier, that were never addressed prior to them being there. And finally, they have a group of supportive individuals that are there to hear them out and help them process that before they are released. So I am definitely, had the pleasure of doing that and really seeing the enhance of the well-being of those women upon their release and getting to see them leave with a sense of hope.
Wow, that's awesome. Thank you so much. Marianne, tell us a little bit about, put on your child advocates hat and tell us about your concerns regarding children and mental health.
Well, I don't really know where to start on that question. I think that we need to look at it pretty holistically, because I think we talk about youth mental health quite a bit. Our youth mental health is a byproduct of our adult mental health. So if we want to focus the conversation on our incarcerated population, I think we can talk about that. The trauma of being a child who has an incarcerated parent. You know, so when we talk about trauma-informed practices within Pennsylvania, we want to think about what are the impacts to the children who, many of the people who are in our facilities, what are they experiencing, right? How frequently are they getting to see their parents? What is it like when they get to see their parents? How often do they get to talk to their parents? Things like that. But I think that's not just with our incarcerated population, but in general, like I said before, just the overall mental well-being of the adults around our children plays a significant role in our children's mental health. They're directly related. So when we talk about the rise in youth mental health and the rise in youth anxiety disorders, I think even just the way we're talking about mental health can impact what we're seeing every day in our communities. So we call things disorders, we call things disabilities, just our language is very powerful, right? And there's a systemic issue there, because we do need some type of a diagnosis often to get the help that we need, the medical or psychological help that we need. But at the same time, we want to try to destigmatize these things. So I think that it's just an overarching, very important conversation that we have to have. We have to destigmatize mental health. We have to make sure everyone knows that at some point you're likely going to need some type of healing within your life, whether it's self-led or led by a therapist or a counselor or a religious organization, whatever it is around you in your society that's going to help you go through your own healing journey. It's extremely important because it has a ripple effect on the children that you work with, whether you're a teacher or a parent or a doctor. If you're a police officer, the children that you interact with, right? Healing from your own trauma is going to be extremely important in how you get triggered and how you respond to children when they're involved in a crime or whatever it is your field that you're in. So long story short, I think what I always try to say is just that youth mental health is directly tied into our adult mental health. And we have to be addressing both. We have to be destigmatizing both. And that's going to be very, very difficult, because here we are preaching that we need to destigmatize mental health, but we often talk about these experiences, and that's what they are. They're byproducts of experiences as disorders.
A good point there. Yeah, language is so powerful. And yeah, I don't know like what what all the answers are, but I find it a little bit surprising now to hear what seemed to me like very young people like say things that I think of like when I was that age, I would have known like nothing about that. Like one of my nephews, had an incident at school and was, saying to my sister, I feel so traumatized. And I'm thinking, what does he know about that? They're so young. Like, how do they now like have these words? And like, this is so much anxiety. And like, I don't remember ever like knowing that word as an elementary school kid. So yeah, I don't know.
And I think making sure that our children understand what those words mean is extremely important, right? And the power behind those words. And I applaud him for being able to share that experience if he did go through something that was quite traumatizing to him. So yeah.
It's very different, very different. So yeah, creating the right spaces to, do you all with the Heal PA campaign, do you have a lot of involvement from educators and, like, do you see the overlap with the ACEs studies and things like that, addressing that?
Absolutely. PDE is an enormous partner of ours in this campaign, and Dana Malakovic actually sits on the steering council for Heal PA. So many of their resources are highlighted on our calendar throughout the month for people. And again, everything's free. It's a click away to get the information. And they also host different webinars and things like that. They gather data on their PAYS data every year. You know, they do amazing things to try to help our schools become trauma-informed spaces. But again, this is not a check the box thing for, first of all, for us at a state level. Definitely not on a school to school level, a hospital level, prison to prison level. We can't check boxes. This is a culture change. We need to start really understanding what it means to be trauma informed. We can't just be checking boxes. It's not that simple. It's how we look at each other. It's how we look at ourselves that needs to change for us to actually become trauma informed and healing centered.
Awesome. What are some action steps you would say the average citizen could take to be a part of the campaign this month?
Join us at one of the events. If you go to the website, there's a lot of information on there, things that you can attend. It's www.healpa.org. I'm not sure if we have that in the chat, but there is a May 2023 campaign tab right on the website. If you go to it, everything is free. It's all virtual. Now, if you go, there are a couple in persons, but if you go to the May 25th day, it says Capitol Awareness Day. That is a full day at the Capitol in person with tons of amazing events that, again, are free to attend. So please register, come, bring your kids if you want to bring them. There's a lot to be learning that day. And we're very excited. There was a Senate resolution introduced last week to recognize May 25th as Trauma and Mental Health Awareness Day for Pennsylvania. And that will be the very first time that we do that, should that be passed. So we're very excited. We also have Ruchira Gupta. She's an Emmy Award-winning author and a UN activist who will be hosting our community healing from human trafficking panel. So we have a number of really amazing panelists on that who are experts right here from Pennsylvania. So a lot to learn there, and an extremely important topic for our kids, especially our kids who are in residential treatment facilities or juvenile detention. They're at extreme risk for human trafficking. So yeah, absolutely. Please just head on the website, learn more about us, and get involved beyond May too. You can sign up to get our communications and learn more and join our Instagram and our Facebook and all that great stuff. So there's no end to what the involvement could look like.
Awesome. Lisa, thank you for that. Lisa, I know you shared a little bit about the support groups. Can you talk a little bit more about some of the programs for building resiliency at OVA, and then the Lunch and Learn that you have coming up later this month?
Sure. I also wanted to mention a support group that I didn't mention before. OVA has partnered with NAMNI Philadelphia, and we are offering a homicide survivor grief support group that people can contact our office to be referred to. We can also put that information probably in the chat, but that is they run specifically on Thursday evenings, and that group is peer led, but a therapist is on staff. So it does provide that extra support for homicide survivors and their families. We at OVA also have several programs. One in particular, Resilient Voices, where we have survivors that can speak throughout the state. We have on our website an event brief for anyone that's interested in having a survivor speak at their event. They can contact our office, as well as an application for any survivor that wishes to be a part of that. They can reach out to us. That is a very healing way for survivors to not only for help other people and prevent crime in a lot of ways, but it is very healing individually for them to share their story with other people. We also have a victim offender dialogue program through our office where victims, it is completely victim initiated. So victims can contact our office if they would like to have a one-time meeting with their with the person that's incarcerated or on parole, and our office would facilitate that meeting and create a safe environment for that to occur for that family or the survivor in that case. We have several other programs that we work with the Department of Corrections on called Impact of Crime, and our inmate apology bank, where we focus on accountability and responsibility. And then, coming up here in May, on May 11th, we're going to have our next survivor, sexual assault survivor awareness lunch and learn. So this is going to be called the empowerment. Let me get my stuff. I apologize.
Oh, it's all right.
It's going to be empowerment, a pathway towards healing. So I'm going to facilitate that lunch and learn, and we're going to look a lot at trauma, mindfulness, grounding, resiliency, and number one, self-care, focusing on how to not neglect ourselves in those difficult times. We will be doing you will get a journal in the mail if you do sign up for that. So we'll be doing a gratitude exercise and self-esteem exercise in there during the lunch and learn. So I'm very excited to see all of you that are signed up for that.
Awesome, thank you. You mentioned the impact of crime class. I wonder if Jen or Lucas, are you familiar with that class being held at DLC? And maybe you could can you give us some feedback from on your end about that class and when, or Lisa, if you want to speak to that as well, because I know you've actually been in on that class. Like how do you see that impacting kind of the mental health of both the victim and the offender when they are, asked to think about that and to hear the survivor explain how the crime has impacted them, and then that person is there kind of like maybe to take ownership or accountability. How do you see that impacting mental health and maybe moving people toward resiliency and restorative justice and things like that?
I think it really assists with that mindset of the person incarcerated, because they may not have looked at victimization in the ways that we discuss it in the class. We focus on different crimes and how those crimes impact someone. And then they actually hear from survivors themselves who are there in the institutions sharing, their experiences. And that can be very healing for the individual that's sharing, because they are able to share with that person, the people incarcerated, that okay, this was me when I went through the experience over the years, what my journey looks like, where I am today, and it gives them that full picture of that. It's also very hopeful for the people incarcerated, because they get to really think about some things maybe they wouldn't have thought about otherwise, and think about ways that they can make a difference inside the institution while they're there, and then while they get out, what they can do on parole within their community, and as far as volunteering or building connections. So we're just throwing some of those important concepts out there.
I find many of the inmates with working inside the prison, when we would run the impact of crime classes, is many of those offenders did not recognize that their crimes were actually victim crimes. For example, drug dealing, many think that that's a victimless crime. They don't think that they're hurting their society, their community, the addicts that are coming and supporting their habits. And so in attending those classes, I feel a lot of that when we would have people that would come in that lost a daughter because of addiction. If we would have some family members that would just come in and speak along those lines, it helped to start to build that aspect of it, because many of the times when these offenders were on the streets, they they didn't have a care about the people that they were interacting with. They didn't have a care with the community members, the kids that couldn't go outside because of the dealings that they had going on. And then through those, that also sparked a lot with the Apology Bank. I found after the offenders attended the impact of crime classes, then they wanted to start participating in apology banks and things along those lines after they started to recognize how their behaviors affect other people instead of just thinking about themselves.
Mhm.
That has to be so powerful, Jen, too, because of just the intergenerational aspect there. How many didn't realize that, oh man, what I experienced as a kid growing up, I perpetuated, right? So
Mhm.
like you led them to this new path to be able to heal, to think about how they can make things different for kids like them in the future, you know, by changing their own actions. So I think that's so important.
Most definitely. And many didn't see, they saw it as the norm. So they
Right.
didn't, that's what they grew up in, you know, abusive households. They thought it was okay to beat people, to punch people when they got mad. And then they get out in society and do the same thing and realize it's not okay. So a lot of it has to do with their upbringing and what they felt was normal against societal norms.
Yeah. That's a good point. So, but we're talking about the trauma-informed PA and how like all the state agencies are kind of buying in and doing what they can do um, to be a part of that. I want each of you to tell me about what's happening at your agency to make you or to make your agency a little more trauma-informed. I can say like at OVA, one, we hired a social worker. Two, we have yoga, an opportunity for like lunchtime yoga, like once every other week. Every staff meeting, we open it up with some type of like a trauma space where we kind of like debrief or we do some kind of something for self-care. We try to get to have trainings and things that kind of promote a healthy office culture and think about what that looks like, really realizing that self-care looks different for everybody, that the way people experience trauma is different, but trying to provide something that kind of addresses that on the scale for every employee. When we have different meetings and spaces like that, we also will put out like doodle things, like if people want to draw during the meeting or if they want to use stress balls during it and different, those are like little things that we're doing, just the kind of quick things that we can do throughout the day, like every day. And then we also have some larger pieces that we try to get people to focus on for your growth and development and being healthy and things like that. And actually dealing with the vicarious trauma from the stories and things that we hear and recognizing that that is something that you have to deal with, that there is no assumption that you're just, you know, because you're such a great advocate that that's not going to bother you. Like we have recognized and acknowledged that that's not true. So, you know, what is the counterpart or what are we going to do? Because if we do nothing, then the body keeps the score and, you know, you will not be able to stay in this work for long periods of time. So those are just kind of some brief little snapshots of some of the little things that we do that we've kind of like put in place that can be done. Like at any time, somebody could step away from their desk and we kind of have like a safe kind of debrief room where it's the colors, the lighting and everything is trauma informed and the person can sit in that space to kind of just do what they need to do to be able to debrief. So tell me a little bit about, and hoping, you know, that we can learn from each other. What does that look like at your agency? And is it like at all levels or, yeah, what does that look like at your agency?
Yes, I can start. I think one of the most important things that has to happen is, and it's going to sound very simple, but building genuine relationships with each other as colleagues, regardless of what any person's title is, right? And creating those spaces then offers the ability to work through any potentially harmful practices that happen day to day that we may not even realize happened, right? So creating those relationships promotes that trauma-informed space, because we're not always going to get it right. We're not, even myself, I'm not always going to do everything that's trauma-informed. I'm going to mess up sometimes. But creating those relationships where when I mess up, my colleagues around me, no matter who they are, can come to me and say, hey, Marianne, can we talk about this? Because people, I'm going to use an example. We had a lunch hour session the other day. It was focused on neurodiversity. And I got to learn about these two different types of language, person first and identity first. And identity first was very new to me. So I was able to learn that, hey, some people in the autism community prefer to be called autistic instead of a person who has autism, and like just promoting those conversations and the safety to have conversations, to have somebody say, okay, I'm comfortable coming to this person and telling them because I know that they're going to hear me and respect me. That's the most important thing we can do to create trauma-informed spaces.
So break that down for me. How did you go about creating those relationships at your office?
I think that takes time, right? And it takes the experience of those situations. And when it does come up, making sure that the individuals who do come to me feel comfortable with me sharing this learning experience that I had, because that way other people are recognizing, are seeing, oh, this isn't just something I'm going to say and it's going to fall on deaf ears. I'm going to say something, there's going to be action, something's going to change, something's going to happen. That's empowering to that person. And it creates just a deeper, more genuine relationship with that colleague or just that constituent. I mean, you get this, Suzanne, as advocates for Pennsylvania, we're here for our constituents. So I really feel the most fulfillment when the other week, a constituent said in an email, just wanted to connect you to Marianne. You can reach out to her. She really will read her email and respond to you. And I read that and I thought, oh, I'm so glad, like there's trust happening here, and that takes time. It's not going to happen overnight. So that goes back into that. We're not going to be trauma-informed spaces overnight. It's going to have to happen gradually and in steps. But I think those relationships really are the first step.
Okay. Jen and Lucas, tell us a little bit about what this looks like at DOC with your trauma-informed initiative.
I can speak as far as I've been in this position for a year now, actually, as of last month. So in the year that I've come in here, one of the biggest focuses that we are doing right now is awareness, training our staff. We have certified 90 people throughout the Department of Corrections, the parole, and our community corrections center to be able to instruct this training, a 4-hour in-person training for our staff, and then also to help promote that within their workplace. And so all of our staff are currently being trained. We are training people every 5 weeks. We have cadet classes coming in for new employees. And so they are getting a day 2 of their basic training. That way they can start this mentality from the door in order to help bring that cultural change that we need in order to be able to do that. We're also starting to work as far as to look at our policy revisions and make sure to look through, because part of that is also educating our business owners for our policies to determine what that looks like, because we can go and say, I can go to somebody and say, is your policy, if we're looking through a trauma lens, is it appropriate? Is it informative? And most people at this point are not fully aware what that looks like. So the awareness, the education aspect, putting groups together. I'm also working now on doing a cross-sector collaboration group, which is going to be our bridge from coming in from the incarcerated walls out into the community, what that's going to look like with parole, what that's going to look like with our community corrections, our reentry staff, the community that the offenders are going out into, to help that continuum of care in order to speed the process up and to be able to link them to what they need, because we can give them as much programming as possible inside the prison. But if we're not continuing it once they walk outside those doors, it falls by the wayside, because all those extra responsibilities start coming on their plate, and then they tend to stop taking care of themselves. So it's more right now in the awareness aspect. We also run programming in the prison. There is trauma programming inside every facility that the offenders are able to participate in. We also have some of our inpatient facilities. Those are geared more towards the female population, but we are starting to look at what that looks like for a male population too, as far as more extensive treatment.
Okay, that's good to hear. Do you want to add to that, Lucas?
Yeah, sure. Just briefly, Jennifer is, she really is the best person to speak about this. She has been the lead person in our agency pushing this with Dr. Laura Harry, our acting secretary. And I'll tell you, one of the things that I like about this trauma-informed initiative that our administration is supporting in the Department of Corrections is the critical eye that we are challenged with having and being transparent about ourselves. And so, it comes from this idea that people can bring with them, or they import risk with them, health risks with them. So they bring these risks with them to prison. But then there's this other aspect, this other view, which is there something about our prison setting that unintentionally creates trauma, right? So, it's hard to do that. It's hard to look at, what we view as the strength of our system, which is our training and our facilities and our staff. And are there things that we are doing that we're not even aware, that have unintentional negative consequences on the patient population? And so the administration, again, led by Dr. Harry, is really supporting this transparent and critical review of what we do, just as Jen just described, review of our policies and operations that may unintentionally traumatize people while they're here. And so it is a challenge for us. And I think Marianne is spot on to say that this is not something that's going to happen overnight. It's not going to be fulfilled by a few trainings, and using terms like universal precautions. It's a culture change and it takes time.
Yeah.
You know what, Luke, if I may just for a second, because I just appreciate what Lucas said so much. And I think Department of Corrections has probably the hardest job when it comes to implementing our trauma-informed PA plan, because prisons are meant to control the people who we place in our prisons, right? It's all built under control. And yet when we talk about trauma and healing, what is it that we need to give a person to heal from trauma? We need to give them some control back. We need to let them lead their own healing. So I don't know that there is any more challenging location to do this than where Lucas and Jennifer are trying to do. So I just want to applaud you both and recognize just what you're up against, what you're facing. And it's just going to be so difficult, and it's going to need such reform, and we can do it. We can get there. There are some wonderful things happening. And I'm excited about the direction that we're going in Pennsylvania because of professionals like you. So thank you.
We're lucky to have Jen Digby leading the way for us, really.
That's awesome.
Thank you, everyone.
As we wrap up, I'm just going to ask each of you to share one thing that you feel would be helpful in ending the stigma around mental health issues. We'll start with you, Lucas.
I appreciate that, Suzanne. One thing that will help end stigma of mental illness, I think, is it's more than just talking about it, right? And it's more than just raising awareness. I think the people I work with will not be surprised by my answer. Like, we're big on relationships and forging relationships with people who are positive in your life, so that you can lean on those people, and so that we can give people a sense of strength through community, and not allowing people to think that they have to go through this journey by themselves or alone, right? They have people that they can rely on, and we've given them the skills to forge these relationships through the sense of community and being with other people.
Nice, I like that. Strengthen community. Jen, how about you?
If I would have one thing to say, I would say comfortability, being able to be comfortable in yourself and who you are, and being comfortable around other people with that. I think a lot of it is looking in the mirror and being able to recognize, this is who I am, this is where I came from, and be able to openly share that with people and not feel that you need to, take it, not have a stigma to it or be what the other people think you need to be.
Thank you. Lisa?
I would, the first thing that came to mind when you said that for me is safety. And that's creating a safe environment for one another. And along with what Lucas said, providing that those positive supports for one another, and being willing to accept resources without judgment, or and just yeah, I'm gonna leave it at that, but thank you.
Thank you. Marianne?
Changing the way we look at mental health. We need to stop talking about it as something that makes someone disordered. Our mental health is a byproduct of our experiences. So really stressing what Dr. Gabor Mate said, which is, you're having a normal reaction to an abnormal experience. There's nothing disordered about this. What happened to you should not have happened to you. That's going to be what changes the way we look at each other and what increases empathy between all of us. And we can't talk about substance use without talking about mental health, right? So, and our individuals who are struggling with substance use disorders probably get the most judgment of all. Let's stop talking about the disorders. Let's start talking about the trauma. Let's start asking what happened to you.
Okay, awesome. Well, thank you all so much for being on our program tonight. This was a really great conversation. Again, this will be added to our YouTube channel so people can listen at a later time or listen again. So thank you very much. And thank you all for the work that you do and the spaces that you sit in, and all the work to create safer, caring communities for all the citizens of the Commonwealth. It's so important, and we're so appreciative to have you tonight and partnering with us along this journey. And we know, like you said, that it's not going to be easy, but that we can get there. So thank you very much for the work that you do. And to all of our listeners, we look forward to seeing you again next month. Thank you. Have a good night.
Thanks,
Thank
everybody.
you.